An investment in knowledge pays the best interest. A quote from Benjamin Franklin. Welcome to AHS Guide, your trusted learning partner for mastering anatomy, physiology, biochemistry, pathology, and microbiology. Here, we make the complex medical concepts and subjects into simple, visual, and exam ready so you can learn faster, remember longer, and apply better in your day to day healthcare services. Now, in today's class, we'll cover an important laboratory function, how to correctly collect the blood samples and the anticoagulants that are used in hematology. So before I go into the collection direct topic, let's explore what are given as per the Rajiv Gandhi website. Now, as per Rajiv Gandhi website, the syllabus is given as such. So under second topic of pathology, that is hematology, it involves various topics and we have covered introduction to hematology, normal constituents of blood, their structure and functions. Now in this video we will be studying about the collection of blood samples and the various anticoagulants used in hematology. These two topics are very wide as well as important. There are various methods of collecting blood samples for different age groups as well. There are various anticoagulants that are used to preserve the blood once it is collected, either for the testing or for the preservation for transfusion of blood to the patients. So we will go into in-depth methods of how the collection of blood is done. So we'll start with the blood collection techniques, focus on the proper patient preparation, the venipuncture techniques, and the prevention of errors that can affect the test results later because of improper methods that are adopted. Then we'll explore the different anticoagulants that are used from EDTA to the heparin like sodium citrate and more. We'll also understand how they work, when they use them, and which tests they are suitable for. By the end of the session, you will be having a clear idea of how the correct collection and anticoagulant choice is directly going to impact the accuracy of the hematology results that are conducted. Without further ado, let's dive into the topic, collection of blood samples. The word that is used for the collection of blood samples in medical is phlebotomy, which defines as the act of drawing or removing blood from the circulatory system through an incision or a puncture. So it is a process of how the blood is drawn from the circulatory system by incision or from the puncture of the blood vessel. Now the purpose of phlebotomy is to obtain blood sample for analysis as well as diagnosis of any diseases. Analysis to see what is the blood count, RBC count, WBC count or platelet counts. That is the analysis, and diagnosis is used to determine what type of disease or whether the patient is normal or having any infections related to the circulatory system. So the overview of collecting a blood sample is how the blood drawing has been practiced for the centuries, and it remains one of the most common invasive procedures that are conducted in healthcare. So we know that anytime a patient is going to an hospital and has major diseases related to the healthcare, the first thing the doctor advises is for a blood test if in case he is not able to determine without any non-invasive procedures. So invasive procedure is thereby puncturing or cutting open or incisioning a human body is called invasive procedure. Now the variation in practice of phlebotomy is that the phlebotomy practices differ widely between the countries, between institutions and among individuals in the same country. So the practice of phlebotomy may be different between the countries. So it might be different in USA and it might be different in India. It might differ in different hospital institutions, or it might differ in the person who is conducting the blood drawing of phlebotomy. Now the factors that might vary during the phlebotomy practice is the blood sampling technique, the training method they have been following, and the use of the safety devices for drawing the blood, and the methods of disposal, reuse of some devices sometimes, and the availability of HBV vaccine for the healthcare workers. So these are the factors that can determine the variation in the phlebotomy. So firstly, the blood sampling technique may be different in different hospitals and different places. The training method that is being taught to the person who is in healthcare profession is different in different institutions, and the use of safety devices might also differ. Some might use the butterfly winged a way of drawing the blood sample. Some might use the syringes as the blood drawing system. So safety devices might differ, and the disposal of these needles may also differ. In some hospitals they might reuse the syringes which was earlier done, like in the traditional methods of the olden days. The reuse of the syringes was seen, but nowadays it is all disposable syringes and a single use syringes. Now the availability of HBV vaccine is also crucial for a healthcare worker who is working with the blood samples. Some patients might have HBV which is undiagnosed. So it is essential for the healthcare worker or the student who is handling with the patients to have a HBV vaccine. So here is the image of how a phlebotomy is conducted, or a peripheral intravenous catheter is inserted. Firstly, the patient's hand is bounded with the tourniquet to dilate the veins or to make the veins prominent. Once the vein is selected, you're going to use alcohol swab to sterilize the area to remove all the microorganisms, dirt or debris that is present on the patient's hand. Then you select the vein that you want to pierce with the IV catheter. After the intravenous catheter, the vein is selected, you see to it that the needle is showing its bevel upside. That is, the pointing side should be towards the vein and the open bore should be towards your side, or facing upwards. Once the bevel up is taken and the vein is selected, you have to go with swift one smooth motion. So it should be fast and it should be smooth and it should be accurate. So that's how you are going to place the intravenous catheter into the patient's vein. So you shouldn't probe, that is, keep on pushing in and out of the vein. It causes pain to the patient. So it is required to select the proper vein, use the proper method, and be accurate at whatever you are doing. Once the vein is selected and the needle is inside the vein, you insert the vacutainers or the syringes that you are using for drawing the blood. And after the blood is drawn, you can place the cotton and remove the needle, or a catheter can be placed for infusion, that is for blood transfusion or for any drugs that has to be administered. So that is how an intravenous catheter insertion is done. Now what are the indications for blood sampling is mainly important to understand. So without any indication or any clinical relevance, the blood sample cannot be drawn. No blood sample should be drawn without the indication given by the doctor. So the importance is for indication. Why is indication important? It is important because it is a common invasive procedure that happens in healthcare. Whenever you visit a hospital, if the doctor advises, mostly the patient suffering from any diseases, major diseases, hereditary diseases, then the doctor advises for an invasive procedure. It is a commonly used, and blood tests are commonly conducted in a healthcare services. Now the primary purpose of this blood sampling is for clinical management and health assessment. So how the disease is managed and to assess the patient's health can also be done with the laboratory test done on the blood samples. Now what is the use of blood sampling? There is a diagnostic test, a monitoring that is done with the blood sampling. So the diagnostic tests that are performed are the clinical chemistry and hematology and microbiology. So the clinical chemistry is, you're going to find out what is the chemistry of the blood components. So you're going to see what all elements are present, elements or molecules are present along with the blood. So the clinical chemistry is estimated. Hematology is studied to find out any pathological conditions, that is any diseases like leukemia or a blood cancer or the blood cell count can be determined by hematology. Now, microbiology is going to determine any infection that has happened inside the blood due to bacteria, any microorganisms that is causing the microbiological diseases. Now, these are the diagnostic tests that are conducted on blood sampling. The other method, the why we use blood sampling is to monitor. To monitor is to find out the regular test that is conducted to find out the normal levels of the components present in the blood. So it is done for finding out the blood glucose levels. So it can be done every 3 or 4 months to determine the blood sugar levels in a diabetic patient or a patient who has undergone a surgery, or in general a blood glucose level can be monitored using blood sampling. You can monitor the drug levels as well. So the amount of drug that is being induced into the patient's blood can also be monitored. The level of the drug inside the body can determine whether it is toxic or the correct amount of drug dosage that is being given. Or sometimes if narcotics, that is like the marijuana or any other non narcotic drugs, the narcotic drugs drug level can be monitored here as well. Hormones in the blood can also be monitored by the blood sampling. There is a therapeutic purpose also for blood sampling. The blood collected from the donors for transfusion or component therapy can be used by blood sampling. So if the patient has low blood count and is required to undergo a transfusion, then a blood sampling is required from the donor to check whether the blood is matching with the donor and the recipient, the person who is receiving the blood. Now, screening is also another method used for blood sampling to rule out the tests like HIV, malaria, and syphilis, which are the diseases that are being common among the blood infections. It is usually done to avoid any further infection to the healthcare profession or while the blood is being transfused to another patient. The screening is commonly done for HIV, which is human immunovirus, malaria, syphilis, which is also a sexually transmitted disease. So these rapid tests are performed, and iron levels for before the blood donation is also checked in order to avoid any low iron content that is inside the blood that is transferred to the patient. Now, the specialized blood sampling procedures are the procedures which require training and cannot be performed by a common healthcare person. It should be done by a doctor or a practiced trainee who knows how to do the sampling. So there are three different types of blood sampling which requires training and cannot be done by a amateur person. So it requires training. So the first type of blood sampling and a specialized blood sampling is the arterial blood gas ABG. So this ABG is not performed on common veins that you see. It is done only in the arteries where blood is gushing out. There is a lot of pressure in the arteries. So conducting this test requires a proper training, and these ABGs are done for patient with on mechanical ventilation. So patient who is on mechanical ventilation, who is not able to breathe by himself, is put into a mechanical ventilation where the machine does the work of the lungs. So those patients may have low oxygen saturation levels in the blood. So the oxygen saturation can be measured by taking the arterial blood gas sample. Arterial blood and the sampling is done to determine the amount of gases, that is carbon dioxide, oxygen, that is present in the blood, and this will monitor the blood oxygenation. Now there is another specialized technique that has to be performed by people who are trained, that is neonatal or pediatric blood sampling. So the neonatal are the babies that are just born and which are 0 to 1 or 2 months age baby. So the neonatals and the pediatrics, which are less the children aged below 14 or 12 years, are considered as pediatric. So these two children require care and training for blood sampling, because the neonatal requires a very small amount of blood. So it has done usually with heel prick, and any excessive force on the heel can lead to other infections that might cause in the newborn baby. So it requires special training, and heel prick is a common method used in the neonatal where a capillary sampling is done, wherein a capillary tube is put at the region where the heel prick is done. The scalp vein also can be used for the pediatric patient. Scalp vein is the veins on the head region. Now, the capillary sampling can be done on the finger or on the heel of the foot. So, finger prick is done or a heel prick is done, and it is rarely done in earlobes. Now, why is capillary sampling used? It is used for the iron level that can be checked before the blood donation. Blood glucose monitoring can also be performed with capillary sampling, and rapid tests for HIV, malaria, and syphilis can also be performed with the capillary sampling. Now, the routine venipuncture guidelines is an important procedure that every healthcare professional should follow, and it is a guidelines that is being put forth by the WHO, which is World Health Organization. So the routine venipuncture guidelines involve certain methods and steps to be followed accurately and should be put into practice by every healthcare professionals. So the things that you have to keep in mind when you're doing a routine venipuncture is a material that is required, the materials that is required for a venipuncture, the safety that has to be followed while performing the venipuncture, the procedures that are done using a syringe or for an infant and child, how the different types of techniques that are being used, and troubleshooting hints for blood collection. If in case you have difficulty while blood drawing, what are the different methods that you can adopt, that is the hints that you can adopt for a blood collection. Now the materials that are used for venipuncture are safety needles, which is 22 gauge or less than that, and these needles have caps on them in order to avoid injury to yourself while performing the blood collection. Now the butterfly needles are also being used, which are 21 gauge or less than that, and we have syringes also to collect the blood. We have vacutainer tube holders to place the vacutainers over there. Vacutainers are the blood collection tubes. Now there is transfer devices also to transfer the blood sampled tubes to the laboratory. So that is transfer device. Then blood collection tubes are also present. These are the vacuum tubes that are designed to draw some predetermined volume of blood. So these tubes will have markings on them. So till that marking, you are supposed to fill the collection tube with blood. So these have predetermined volume of blood, and these are vacuum tubes along with certain additives added to them to avoid the blood clot formation inside the tube itself. So if the blood is clot, the test cannot be performed. Hence there are some additives added, and a specific type of test based upon the type of test that is performed using the blood sample, there are certain additives depending upon the test that is done. Now there are color caps for each of the collecting tube to identify the type of additive that is used inside it and the type of test that can be performed for the tube. Now tourniquets are a single use or disposable. There are both types available. No, single use can also be used and disposable can also be used. So if the single use is being used, it has to be sterilized between different patients. And disposable, you can use it for one patient and can be thrown out. There are latex free tourniquets as well. Latex can cause excessive pressure on the vein and cause bleeding too much. So to avoid the latex usage, there are certain latex free tourniquets as well. Now antiseptic, it is essential, and for sterilizing the area where venipuncture is done, and it is usually with 70% isopropyl alcohol wipes are preferred. 2 by 2 gauze is also used in order to contain the blood spills that is happening while performing a venipuncture. There is a sharp disposable container which is a puncture proof container and should be marked as biohazard. There are bandages or tapes also to secure the once the blood collection is done. So these are the images of how the blood collection is done. You can see a butterfly needle which has a different gauge, 18 gauge and 27 gauge. You can see the difference between the two needles, the bore size. So 18 gauge has a larger bore size, wherein allowing a lot of blood, larger amount of blood can be drawn. In 27 gauge, smaller amount can be drawn. So 27 gauge can be used in the baby, the pediatric patients or the people who have small veins. 18 gauge is used for the larger veins and for larger collection of the blood. Tubes are the butterfly needle is connected to the tubes. This tube can be put into the vacutainer and the blood can be collected at this end. This is the region where the vein is being pricked. So you can see this is the container that is used to vacuum seal between the needle and the vacutainer or the collection tubes. Here is a syringe and a needle with a safety cap. So recapping should not be done, which I'll be telling in the next video. We have collection tubes with different colored caps. So each color determines the different test that is being conducted using that. You have markings also. You see those black markings on each tube. So that is the level of till which the blood should be filled. So each tube has the black marking, small black marking box kind of thing. Till there it should be filled. Now there is a tourniquet, image of a tourniquet, a band-aid, and this is like the kit, total kit of what all is required. The 2 by 2 gauze as well, and there is puncture proof needle, which is a white container with biohazard labeling. All the sharps should be put inside this only once it is used. Now the safety precautions that should be followed in order to contain the infection as well as to be aware of whatever procedure you are doing. Safety is must and should for both the patient as well as the healthcare professional who is performing the procedure. Now you should observe the universal standard safety precaution. It is a universally followed standard precautions that should be adopted by every healthcare professional. Here observe all the applicable isolation procedures. The isolation procedure should be performed. That is, you cannot allow more than one people while performing a blood sampling. So isolation procedure is essential whenever the disease is said to be infectious or the blood is said to be infectious. PPE should be worn at all times. PPE is we have heard this PPE word during COVID time or the corona period because it was essentially used by all the healthcare professionals to avoid and contain the infections. So PPE is personal protective equipment kit. Now we'll see the image of what PPE is consisting of. Then the fourth safety precaution that you have to take is you have to wash your hands in a warm running water. It is preferred to be a running water in order to whatever the debris that is attached in your hand or the microbes in your hand can gush out along with the water. Hence running water is appropriate for along with the hand washing product should be used. Hand scrub can be used to remove the germs in your hand. Then if the hands are not visibly contaminated, you can use a foam hand wash in between different patients. So you are supposed to wash your hands in between different patients, or a foam hand washing can be used if it is not contaminated with blood or any other infectious agents. Now the sixth point is gloves should be worn at all times in a phlebotomies. So it is essential for a person who is performing blood drawing to be wearing the gloves at all times, and it should be changed between different patients. So this is a PPE kit. There is a full body suit with the cap as well, eye goggles to protect the blood spillage onto the eyes, and face mask. It is usually 3-ply disposable face mask is preferred. We have surgical gloves or daily routine gloves that can be used, and the shoe cover is essential to contain feet from blood spills on it. Then there are disposable covers. Here you can see a running water along with the proper hand wash technique, and we have person wearing gloves at all times when drawing blood. Palpitation of phlebotomy site may be performed without gloves provided the skin is not broken. So you have to see whenever a venipuncture procedure is being performed, the skin is not being infected, or it has any burns, or it has a injury at the site of venipuncture. So you have to check before you put your hand on it. So without gloves, you're not supposed to touch the region where the infection is being caused, or there is an injury, because there is a chances that the patient might have an infected blood. So it is essential to see the phlebotomy site. Without gloves is not recommended for a broken skin. A lab coat or a gown must be worn during a blood collection procedure to maintain the professionalism. So lab coat or a gown is going to essentially indicate that you are a lab professional and a phlebotomist. So it is essential to wear lab coat or gown and to maintain the professionalism. Ninth safety tip is needles and hubs are single use and are disposed at in appropriate sharp container as 1 unit. So needles and the hubs of it, that is the region where the needle connects with the syringe. So both of these are single use and should be disposed of appropriately. That is, it should be put in sharps container only. You can't throw it in different containers. So there is color coding for each disposable items that you use for medical field. So for needles and other sharps, it is usually white container, which is a puncture proof container. The needles are never recapped. It should never be recapped, never be removed with hand, never be broken or bent after the procedure is being performed. If in case you have if in case you have drawn the blood and you want to remove the needle, it should never be removed or recapped. It should be directly put into the sharps only. Don't use your hand, because chances of injuring your hand, your finger or hand with the patient infected blood to your blood can cause cross contamination of the blood and diseases might spread. Gloves are to be discarded in appropriate container immediately after a phlebotomy procedure is performed. You're not supposed to wear the same gloves and touch the blood bottles. So once the blood is removed, the patient is being bandaged, you are going to remove your gloves immediately and after the procedure is being performed, and should be put into proper labeled containers for the gloves. Now 12th point that you have to notice, all other items used for procedure must be disposed of according to the proper biohazard waste disposable policy. So there is a biohazard waste disposable policy that is followed internationally, and it is essential to maintain this proper disposal of waste in order to avoid complications later, because the sharps might cause injury to the people who are going to segregate and throw out the waste. So it is essential to properly segregate the waste that you are being discarding after the single use. So it is important to know whichever color codes is required. I'll be covering another video for the biohazard waste management. I'll let you know in the color codes for each and every waste disposable that is happening. The contaminated surface must be cleaned with a freshly prepared 10% bleach solution. All surfaces are cleaned daily with the bleach. Now the contaminated surfaces wherein the place where the patient's blood is being drawn should be cleaned and it should be cleaned with the freshly prepared 10% bleach solution, and the daily basis of cleaning with bleach should be performed every day. After each patient, or the contaminated surface should be cleaned on daily basis, as well as after the patient blood if it is a spill on the surfaces. In case of an accidental needle stick injury, then immediately wash the area with the antibacterial soap, express blood from the wound and contact your supervisor. So in case if you accidentally injure your finger or your hand with the patient infected blood syringes or needles, then you're supposed to immediately wash that area with the antibacterial soap. Try to squeeze out whatever blood that is being caused by in the wound from the wound. So you're going to compress it, and the excess of blood that is there, you are going to remove it under the running water, and then you were supposed to contact your supervisor for further instructions based for the infection that is caused due to accidental needle stick. Now, the procedure I'll be covering in another video. Till then, keep watching AHS Guide. So don't forget to subscribe to the channel, because I'm putting in more effort for you guys to understand in a simpler terms. Rather than reading the notes, I am doing it in PPTs. So these PPTs will be put in the description as well for you guys to refer it, and the revision will be done once the topic is completed. Till then, keep watching AHS Guide. Thank you.